I hope the music is a little upbeat, giving you guys some positive vibes. Great. All right. Okay. Um, Welcome everyone. Hi, it's great to have you here. My name is Shonda Cooper. I'm one of the diversity and inclusion managers at Tiger Lily Foundation, and we're so delighted to have you here joining our October Pull Up a Seat, this bi-directional conversation series. Today's topic is on eliminating financial burdens and finding solutions to helping with women dealing with breast cancer treatment. So financial burdens and breast cancer treatment. We have an incredible lineup, a huge, great group of panelists that are going to be speaking, and a phenomenal keynote speaker. So I just want to make sure that you guys can see my screen as I switch to the next slide. So this is an introduction, just welcoming you all. I'll share setting the stage for the room, and then our reason for the pull up a seat. I'll share a little bit about GRASP, which is our partner organization, and then we're going to hear from Lasagna Barnett from Duke Cancer Center, who is our keynote speaker. After that, we will break out into breakout rooms, and we will each have an opportunity to engage with our patient experts. During that conversation, we will have introductions for you to, introduce yourselves, and then also to talk about some of the conversation some of the points that Lasagna brought up in her conversation, as well as the stories that you hear from some of our patient experts. This will help us to facilitate conversation and really exchange ideas towards solutions as it relates to sharing financial resources and removing this financial burden that's been placed on a lot of our patients. After that, at 12 o'clock, we'll reconvene to connect the dots. We'll hear, connect that data. We'll hear recaps from the breakout room, and then we'll have an opportunity for audience feedback. Throughout the conversation that we're having, please feel free if you have any questions for our panelists or our keynote speaker to please write them in the chat, and we'll definitely make sure to have them answered as we continue throughout. Okay, how to be in conversation. We just ask that you all please monitor your airtime, speak your truth, speak from your own experience, lead with curiosity and not judgment, and most importantly, to please keep this space safe. Our why. The reason why we do this work at Tiger Lily Foundation is really because of women that are on this call, for women who are going through treatment before, during, and after breast cancer. We're really impassioned, emboldened really to educate, advocate for, and empower and support young women. Our founder, Mama Karma, was diagnosed with breast cancer at the age of 31, and she really had to be her own advocate in that experience, being able to advocate for a biopsy. And so we have, one of our Tiger Lily TLF angels who has transitioned on the left, Shantae Randall, who remained an advocate and her legacy continues through the work that we do to continue to share and provide resources and information for other women and those who are going through treatment. So our focus with Tiger Lily, we really envision a future where breast cancer diagnosis doesn't inspire fear, but it ignites hope for a future. And so we've been doing a lot of work with disparities since really, honestly, the inception of Tiger Lily, and continuing on, I would say, like in March of 2019, we really started collaborating even more so with our strategic partners on disparities initiatives. Some of these I'll highlight because I know there are a lot on this slide, but we started a Young Women's Metastatic Breast Cancer Listening Summit. And then we've also been really active on the Hill. We have an annual Young Women's Breast Health Day on the Hill, where we bring advocates to Capitol Hill to appeal to legislators on different issues as it relates to healthcare. We actually have our 8th annual Young Women's Breast Health Day that will be on November 3rd. It's going to be a virtual summit, and we're going to be helping to support the survivorship bill that is currently in the works. So we'll definitely share more of that information later and with you all. We also have worked a lot with San Antonio Breast Cancer Symposium. In December, we were able to speak at that symposium through a fireside chat, and we were able to bring a lot of actually the largest group of Black women to San Antonio Breast Cancer to really discuss, for them to share their stories and to build that bridge between, physicians and patients and scientists and researchers. And so we've continued that onward through our angel advocacy program, where we have a cohort specifically of MBC angels. And our angel advocates really are, we've been looking at really targeting and helping to raise awareness for women who are within the 20 cities with the highest mortality rate for breast cancer, for Black women, to help to give them the tools to help support them to be able to be leaders in their community and to help to create change in those spaces. So those are some of the works that we're doing. We have our inclusion pledge, which we have over 12,000 signatures, and that what the inclusion pledge really is about, it isn't about the numbers of signatures, it's about the pledge, which is to help to end health disparities, help to end, remove barriers to care for Black women in our lifetime. And so we ask all of our stakeholders to participate in that, because it isn't just one person. We each have an ability and a role to play within that. That is a part of what we're doing. One of those barriers to care that we've talked about is financial toxicity and lack of access to that. And so our conversation today specifically talks about that barrier and working towards resources and sharing that. So for a little background on No More Disparities and Pull Up a Seat. Last week we had our No More Disparities conversation, which is a for us, by us conversation, a space for Black women to come and have honest conversation. It isn't recorded. It's a space for also for allies to listen and to hear about these disparities firsthand, so that we can say collectively no more to disparities by understanding what these disparities are. And we also have our Pull Up a Seat, which is today, where we have our, it's co-hosted by our Black patient experts and Black medical professional to amplify the voices of Black men and women through candid conversations. And we'll be able to hear from Lasanya today about the work that she's doing and be able to provide some of the resources that she's been able to cultivate through her experiences and through her work experience, as well as personal as well. So we're so excited to have her here. So a little bit about GRASP. GRASP is our one of our partners on this program through this initiative, and they really work towards helping to connect researchers and patient advocates to learn from each other. It was created by Christine Hodgden and Julia Mawes, who are both women living with metastatic breast cancer. And they've really been able to, they've been really great allies in terms of helping us to support the work that we've been doing. So on to our phenomenal panelist. We have Kimberly Skinner here. Kim is a 39-year-old single mother of 2 teenagers who was diagnosed in November 2019. And she's a passionate patient advocate from residing in Huntsville, Alabama. So I'm going to just share a little bit about them, but I would love for them to introduce themselves and to share their own stories. So we also have Jamila Cole, who was diagnosed at the age of 34 and is a 2-year cancer survivor living in Washington, D.C. We have Camille Lewis, who is a triple negative breast cancer overcomer and a single mother of 2 sons. She resides in Denver, Colorado area, and Marika Lisa Cole, who is a survivor of stage 2 invasive ductal carcinoma breast cancer, and she was diagnosed at the age of 36. So we are so excited to hear from these ladies. I'm going to stop sharing my screen so we can see their beautiful faces and welcome them to this program. So I'm going to pin them and ask them to speak. I will ask if Marika could start us off and share her story, and then followed by Kim, Camille, and Jamila. Thank you.
Hi, everyone. Good morning. Yeah, it's still morning, right? Happy Friday. As Shanda said, I'm Marika Cole. Was diagnosed at 36. I'm 38 now. I was diagnosed with stage 2 invasive ductal carcinoma. And I'm just here today because the financial burden is something that's close to my heart, really, because when I started out trying, seeking what my diagnosis was, I had to pay very high copays and et cetera, just to learn what my diagnosis was. And that part was stressful. Like, I needed to know what was happening with me so that I could have my diagnosis treated. But in order to really find out what was going on, it was a financial burden. And so I want to try my best to help to eliminate that for anyone coming up in the future. So I'm here today. I'm so thankful for Tiger Lily and being able to collaborate with them and all of you ladies. And so I just hope and pray that we can help the next people coming behind us who may have the same issues.
Thank you so much, Marika. Thank you for being here and for sharing. Yes, that is our hope as well, as we continue to go forward with this journey. And as you said too, I mean, it's something that continues even after the financial burden after treatment is still something that is a stress, to others. So we're glad that you're here and able to share, and look forward to you discussing and leading your breakout group. So on to the Camille.
Good morning, everyone. My name's Camille, and I live in Denver, Colorado. And I was diagnosed with stage 2, grade 3 triple negative breast cancer. And I'm very grateful for the incredible, extraordinary work Tiger Lily's doing. This particular subject rings true for me personally, because prior to being diagnosed, I had already faced a lot of financial challenges anyway. So it just made things harder. And I really had to reach. What I would like to share is the importance of asking questions, because information is power and information is valuable. If you know the right things, it's like currency. Information is currency. So I was really interested in brainstorming and coming together with information, resources, ideas, and everything involved and centered around the financial burden that comes with this type of diagnosis. And I'm really happy to be here.
Absolutely. Thank you, Camille, for joining us and for sharing as well. And so excited to hear more about the work, that, how you've been dealing with it. I know that in our No More Disparities, you talked about grants as well, and applying for grants and that process, and how, challenging all the different no's, but also being able to receive yeses to help with that support. So thank you for being here, and excited to be able to talk more and hear more about your experience. I'm going to pass it on to Kim.
Good morning, everybody. I was misdiagnosed at the age of 38. They told me I had a clogged milk duct, or just a fibroma in my left breast. That didn't sit well with me, so I went and sought my own help, and found my general surgeon, who took my tumor out, and I was diagnosed with stage 2B triple negative breast cancer. Went through chemotherapy and radiation for that, had a lumpectomy, had a PET scan, and ended up having ovarian cancer right after I had just finished with breast cancer. The financial struggle is still there. I have outstanding medical bills. I went to my oncology appointment yesterday, and I had a $50 copay, and I was deemed non-compliant. And it wasn't that I was non-compliant, it was either all these medicines that they have me on, or put food in my children's mouth. It was either appointment or keep a roof over their head. So I made those tough decisions, and my body suffered for it through my journey. My thing is, when I was younger, I didn't care about insurance. I wanted the lowest price of insurance coming out, because I needed the most coming in. So my thing is, tell everybody, read that fine print. You never know what tomorrow holds. I had Aflac cancer insurance, but cancer didn't run in my family, so I got rid of that. I was like, I'm paying extra money for something that I didn't need. And 1 month after canceling that, I was diagnosed with breast cancer. So read that fine print of your insurance. Make sure that you have certain different things that are needed for crisis, such as breast cancer. And like Camille said, ask question. Knowledge is currency, and that's what I'm gaining from being here with Tiger Lily, is finding so much information that I can share with different individuals in my community that are going through. And so maybe their journey to be a little less hardship than mine was.
Thank you, Kim. Thank you for being here and for sharing your truth as well. And I'm going to pass it on to Jamila.
Good morning, everybody. My name is Jamila, and I live in DC. I was diagnosed 2 years ago today, actually, with initially it was stage 0 DCIS, and over the course of the next 4 months, it progressed to ultimately being stage 1A invasive ductal carcinoma, hormone positive. The reason I was interested in participating in this is because I've had other minor health issues, relatively speaking, and I was aware of how expensive even just the diagnostic testing could be. And every step of the way, first thought that went to my head, besides, am I going to live, is, can I afford to do this? And are they going to not to deny me treatment because I can't afford to pay it? And what does this look like for me? As my journey progressed, I was very fortunate to have great coverage in some areas, but was often triggered by the fact that one part of a treatment might be covered, but something else may not. And in my head, I was constantly thinking, well, I can't do one without the other. So what logical sense does this make? I also became painfully aware of all the things that don't necessarily translate to medical treatment specifically, but simply being able to afford to get to and from treatments, or making decisions about what medical center to go to. If I find a doctor I really like, or care that serves me well, but it's not in my proximity, can I afford to get to that? And what does that look like? I've encountered not just myself, but a lot of other women who've had to make medical decisions, not based on their best course of treatment, but simply having access and affordability in getting to said treatment. I also, along the ways, came to learn the difference in care based on where you live. I was grateful my doctor at many stages was able to say to me, you know, living in DC, that's covered. You know, a health insurance company is going to pay for this because that's the law. And finding someone else who was going basically through the relatively same treatment, being told that, you know, you need to start a GoFundMe because that same level of care is not afforded to you just 5 miles over in the state of Maryland. I would definitely piggyback on what Camille just said, and Kimberly, in regards to the fine print. I am not a fine print person. I'm still trying to understand the fine print and understand not only what's covered for me now, but the impact of how cancer affects my future endeavors when it comes to insurance coverage. If I lose my job, if my husband loses his job, and we're unable to maintain that coverage, can I keep my coverage? Will I be able to get new coverage with a recent diagnosis? On the call we had last week, we briefly talked about social workers and the involvement of social workers. I declined talking to a social worker at the time. And in retrospect, I really think that it shouldn't be optional. I'm definitely an advocate for making that part of a treatment plan. It is not outside the medical care because it plays heavily on our mental health while we go through treatment and our ability to manage stress. But I think that so much goes into the physical treatment that we lose sight of that. I think that that's probably I don't want to take up too much time, the summation of it. I think the last thing I said last time was about understanding the fine print and FMLA. That was the last thing. Definitely understanding how FMLA works and what your options are pertaining to being able to take off while you're in treatment. I worked the entirety of my treatment process and at the end was burnt out. I did it, does not mean it was the best thing for me. And I didn't understand at the time, literally in dollars and cents, what it truly meant. It just seems like more paperwork. And having someone there to navigate and advocate for you financially. I was really good, I think, at advocating for myself on the treatment side, but did not have the tools ready to advocate for myself on the financial side. So anything I can do to learn and help somebody else in that situation, I think we can all grow.
Thank you, Jamila. Thank you. And thank you to all the ladies for sharing about your experiences. I remember too, I think last week on our conversation, Jamila, that we were also, I think you mentioned about life insurance is another area.
Yes.
And
Yeah.
when you can get life insurance, you know, once you maybe not knowing about the importance of life insurance, and then after that having to, how can you get it once you actually have a need for it, and how, you know, thinking about these things as well as the transition. If you are going through something, if you're under one insurance coverage and you've started breast cancer treatment, but something may happen or life circumstances that you may need to change it, how do you go about doing that? You know, these kind of things, that making it easy for women, for those who are going through treatment, to be able to understand like the fine print. It shouldn't be so fine that it's, you have to look at it through a microscope. It needs to be something that's very easily read and understood. So you know, that, yeah, so that we can be able to at least, you know, talk about it and share that as well very easily. So with that, I would love to share and introduce our keynote speaker for today. We have with us, I'm gonna spotlight her. We have with us Lasagna Barnett, who is the Senior Program Coordinator at Duke Cancer Institute, Office of Health Equity. In her current role, she is responsible for planning, coordinating, administering, and supervising activities within the, within the community outreach and engagement, health education, and health screening and community-facing navigation program areas within Duke Cancer Institute's Office of Health Equity, as directed by OHE leadership. She has an in-depth 16-year history of patient navigation, which began through a National Cancer Institute Health Disparities Grant in Southeastern North Carolina that includes prevention, screening, and survivorship, particularly as it relates to her historically marginalized communities. Her focus on navigation is based upon her certification through the Harold Freeman Patient Navigation Institute in New York. She contributes her success in navigation to the founder of Patient Navigation, Dr. Harold Freeman. That, coupled with her background in psychiatric counseling and criminal justice, ensures her ability to connect and make a difference within communities that need the most support. Thank you, Lasagna. I'm handing it over to you.
Thank you so much, Shanda. I'd like to first say thank you to Tiger Lily for the opportunity to present today and to have a conversation in regards to the financial burden of breast cancer and finding solutions. As I look back in my career, which started in 2005 with the National Cancer Institute, I had no idea what patient navigation entailed. I've been certified since 2013. And as Shanda said, I was certified with the Harold P. Freeman Patient Navigation Institute out of Harlem, New York. Many of you may not know that Dr. Harold Freeman was the founder of patient navigation. He is an African-American oncology surgeon that found out that in the 1970s, he was looking at his African-American breast cancer patients and found that they were dying at higher rates and could not understand the reason for it. And so after, talking to a few of his patients, he was finding that they had a lot of barriers. And these barriers was keeping them from moving forward in their treatment or having the best outcome. And one of those barriers was finances, because these women were diagnosed with cancer and they already had financial burdens before even entering a healthcare system. So today, I want to talk about a little bit about the financial burden of breast cancer. I want to thank Kimberly, Jamila, Camille, Marika for sharing your stories. I've had the opportunity to meet these women last week, and I must say that their stories are incredible. I must say that, you know what, my heart goes out to you. I have generated a relationship with you ever since I have reached out to you and we had that conversation. You've just been on my heart, and everything that you have gone through. You are incredible women, and I love you so much. Even though we are not in the same state, I love you so much, guys. So hopefully this presentation provides a little information and a little light on navigation. And that is one of the solutions that we will talk about when it comes to helping with the financial burden of breast cancer. So the National Cancer Institute states that cancer is one of the most costly medical conditions to treat in the United States. Cancer patients can receive multiple types of treatment, including surgery, radiation therapy, and systemic treatment. Historically, inpatient hospitalizations have been the major drivers of the cost of cancer care. So is poverty keeping us sick? Well, certainly, if you were not in poverty prior to coming into a breast cancer diagnosis, the financial component of going through breast cancer can definitely place you within the realms of poverty. And this is something that we definitely have to look at within our healthcare system. What are the ways can we help breast cancer survivors overcome the financial burdens? Let's take a look. When you take a look at this word cloud, it brings out many things and many words that really resonate with me in working with breast cancer patients over the years. I have worked with breast cancer patients that have found themselves being unemployed as they're being treated. I have found that they have had much sadness and suffering, and they panic, and they're going through a lot of stress because, you know, they're just being told that they have breast cancer. And then they're already having a financial concern coming into the healthcare system. And so all these things are going on in their mind. You know, am I going to live? If it is a single mom in the home, how am I going to support my family? How am I going to pay my bills? How am I going to keep a roof over my head? So all of these are all the things that individuals are thinking about as they're going through a cancer diagnosis. So I wanted to show this distress thermometer because this is the thermometer that we use within the Duke Cancer Institute to evaluate patients, cancer patients. They can be breast cancer patients or diagnosed with other cancers. And so when we look at this distress thermometer, we see that under the practical problems, insurance and financial could be one of those concerns for individuals. And what's important when we give this distress thermometer is that we give it at certain intervals throughout the treatment of an individual, because circumstances can change for a cancer survivor at any point in time. So when they come into the healthcare system, maybe they're not having any concerns when it comes to insurance or housing. But say, for instance, they're not able to work as they are going through treatment and they need someone to provide care for their children. They still have to pay rent or mortgage. All these things are issues that can cause problems. So it's good that when you have a navigator that they're able to sit down with a cancer patient and go through the distress thermometer and also talk about some possible upcoming distressors or barriers that may happen as people are going through their cancer journey. And one of the things I must say is that it is important for you to have a navigator or an oncology social worker or an oncology navigator that can help you through the great maze. And I remember Jamila saying that she declined help from a social worker. So that's going to be one of the questions that I'm going to ask Jamila to explain the reason why you declined help from a social worker. I think sometimes, even as African-American women, we take on so much that we say we can handle this. But when you put a cancer diagnosis on all the things that we deal with in society, it makes it even more difficult for us to get through cancer treatment. And so it can break you down to the point where you're saying, you know what, I can't do this. I'm not about to worry about my finances. I have had women that said that they're not going to move forward with treatment because they just can't afford it, and it happens every day. So when we look at the biggest issues facing healthcare today, cost and transparency is at the top. Now, when I talk about transparency, when people are coming to the healthcare system and being told that they have cancer, there is not a looking glass where they can see through the system and they can see all the barriers that they are going to encounter as they're going through the system. So it becomes difficult. So they cannot go look through the looking glass and say, hey, I'm going to have a transportation issue, or I'm going to have a problem where I need a support group, because some people don't know what to expect. Nobody ever wants to be told that they have cancer. But with that comes a lot of concerns. So let's take a look at what patients go through. So I love this slide. I had to incorporate it because the healthcare system is a maze. It is a maze. Every system that I have ever been a part of, which I've worked in smaller healthcare systems, I've worked for UNC Lineberger Cancer Center, and now I find myself within the Duke healthcare system. Every system is different, and I work in the system, and I am within this maze. Because as a patient navigator, sometimes it's hard to find what resources are within my system. And I've been at Duke for 2 years, right? And it is still hard for me to navigate individuals throughout the healthcare maze. So I can only imagine what it's like for individuals that are just entering into a cancer journey. They don't know where to go. They need direction. It's even more stress on individuals as they're going through this healthcare maze. So one thing that I want to talk about is equality versus equity. When we look at equality, we think about the healthcare system that implies that everyone is the same. It promotes fairness, assuming everyone starts at the same place. When you look at the left side of this picture, you see the gentleman to the far left. He's already tall. He can see over the fence. You see the little guy in the middle, he's barely making over the fence. And then the far right, this person cannot see over the fence at all. So that's equality. They're given the same size box, same height, but is everybody able to see and be a part of this ball game called the healthcare system? Not really. So let's look at equity. Equity implies that within a healthcare system, everyone is given what they need to be successful. Is that necessarily the case? Do you feel like everybody is given what they needed when they come into a healthcare system so that they have the best outcome? I see Jamila shaking her head no. And that is the answer. No, it does not happen. So the reality of it is that you have individuals that need so much more to help them get over those barriers, one being financial. As if you look to the right, you see this is really the reality. And for some of our historically marginalized populations, they start at a lower level in their communities. They are not at a good financial standing. There are many barriers that they face. And the reality is that within a healthcare system, if they don't have someone that's going to hold their hand and take them through it, they will have a terrible outcome. So I want to touch bases on our vision and mission within the Duke Cancer Institute Office of Health Equity. So our vision is to excel as a leader in reducing those cancer disparities through authentic community engagement, and partnerships. We are to deliver a seamless cancer care and the provision of outstanding and innovative research and resources to achieve optimal health in a changing and diverse environment. Our mission is to reduce the cancer health disparities and promote health equity within the Duke Cancer Institute catchment area. And the way we do that is by these 4 core areas: community outreach and engagement, community-facing patient navigation services, health disparities education, clinical trials education, and workplace diversity. If you notice, I highlighted health disparities education. And that is one of the points that I want to talk about, because if we can educate individuals in the community, even before they have a cancer diagnosis, about what resources are out there and what questions to ask when they're in the healthcare system to get their needs met, then we know that they fare even better as they're going through a cancer journey or a cancer treatment. So when we talk about health disparities are a higher burden of illness, injury, disability, or mortality for a certain population. And the populations that we target at our office are the historically marginalized populations as African Americans, the Latino populations, LGBTQ, as well as Native American populations or Asian populations. So these are the populations that are having the highest health disparities. They're dying at higher rates. And our goal is to change that. So when you look at the definition of social determinants of health, the Department of Health and Human Services defines social determinants of health as conditions in the environment where people are born, live, learn, work, play, worship, and age that affects health, functioning, and quality of life. Cancer disparities reflect the interplay among many factors, and that can include health, behavior, biology, and genetics, even have a factor on individuals as they're going through the healthcare system. So what are some solutions to financial costs of breast cancer? So within our office at the Duke Cancer Institute, we have what is called community-facing navigators. So we are able to provide a list of services to help individuals. We provide bilingual education to community members on cancer risk and screening guidelines. We assist patients in establishing a medical home, because we have many individuals, particularly now that we are in this COVID journey. There's individuals that have lost their job and lost their insurance along with it. And they feel like they cannot go and get a cancer screening because they don't have health insurance. So it's our job to help them with connecting them to a primary care provider, even if they are underinsured or uninsured. So that's one of the jobs that we do, assisting patients in obtaining financial help for their medical care. That is number one. So if you have a navigator, whether it's an oncology social worker, oncology navigator, they should have an expertise in knowing what financial help is out there for each individual case when it comes to a cancer diagnosis. So this is just our screening navigation process. When we invite individuals in, or we find individuals that are in the community, we find them through outreach activities, or it's a referral to us from people in the community that know what we do, or it's direct contact or no shows within the healthcare system. We assess the needs of the patient, and it may be many, many needs that they have. It may be cultural, transportation, healthcare access. Then we look at their financial assessment. Are they undocumented? Maybe they have no insurance. Are they underinsured? So we evaluate that and we put the picture together for each person, and then we send them to whatever services are available. So for our area, if we have individuals who are diagnosed with cancer and they need to also see other specialists and they do not have insurance, then we have a program based on finances that is called Project Access that we can refer individuals to. So when we look at resources for financial stress during cancer, I have listed some of the resources that are perfect areas that people should know about and should reach out to. So the American Cancer Society is the #1. They have a website that you can change and it can be in multiple languages. And they have great information of resources for individuals that need financial assistance. Cancer Financial Assistance Coalition, Cancer Care, Triage Cancer, Health Well Foundation, and SAMS funds all are resources that individuals can reach out to for financial assistance through their treatment process. And so I have used some of these resources to better help some of my breast cancer patients in the past, and it's been very helpful to them. And the one thing that I'm able to do is to teach them to become an advocate for themselves. So not only am I helping them with the resources by using some of these foundations and some of these sites and organizations, I'm also teaching them how to be able to become an advocate and navigate for themselves. And I would hope that my patients were able to share this with others, because there's so many people out in the communities across the United States that have no idea where to turn when they need help with finances as they're going through cancer. So that concludes my presentation. I'd like to have discussion. If I could, if we can open up the mic, if you guys can, just talk about some of these discussion questions that I have. My first question is how difficult is it for those being treated for cancer to ask for help?
I'll go. This is Kimberly. It was hard for me to ask for help. There's a stigma in the African American community that we're just strong Black women, and I just thought if I didn't want to let my cheering squad down, my support system down by saying, "Hey, I need some help." I kept trying to make sure that they were okay and I wasn't okay. And so I found it very hard to ask for help. Like there wasn't a welcoming environment for, if you, it's not a sign that says, if you have questions, come here. If you need this, come here. There was nothing that would have led me to even ask the questions that I needed to ask because I didn't know. And so I just felt, for me, being where I am and where I was in my journey, it was hard to ask for help.
I hear that from a lot of women, Kimberly, that there's no one that comes to them and says, you know what, if you need any help through this journey, you're not alone, please reach out. Because not every patient that goes through a cancer journey has a social worker or even knows that there is a navigation within the cancer center that they are being treated at to be able to help them. Because, as African American women, we are seen as being very strong creatures. And so we just go through the system and we say, we can get through this. Even though there are barriers that come our way, we try to just go through it by ourselves. But I'm here to tell you today, please ask those questions, search for navigators, search for social workers that can help you through the process, because you don't have to suffer through this financial burden that cancer brings on by yourself. That's so important, so important. So Kimberly, were you able to get any help throughout your process? Did you have a navigator at any point?
I didn't have a navigator until yesterday. And she said, "Oh, I've been here the whole time." It wasn't given to me. But have noticed that the women that are of different ethnicities, they were given that. And I was just supposed to be that strong person. They didn't think that I really needed the services that they provide. And so, no, I did not get any help. I was homeless during my treatment. Me and my kids were in the car because I couldn't do treatment and provide a roof over their head. And now being in the surveillance status that I'm in, I still am struggling to provide. I can't work as many hours as I used to be able to work, standing up in the hospital 12 and 16-hour days due to the long-term effects that come from cancer, like neuropathy. So I didn't get the resources that I needed during, and then seeing that I'm in the surveillance phase, there's not seem to be resources that help you once you're done in what they say active treatment.
Mm-hmm. And that's so true. And it's unfortunate that you didn't get a navigator until yesterday, and you're at the end of your treatment. So that's why I said, when I showed that distress thermometer, that should be shown to the patient from the beginning when you're starting the treatment, right? And I'm so sorry to hear that you were homeless through your treatment. Have you been able to overcome that obstacle?
I have not overcome that obstacle. I go from friends' houses, couches. My kids are now 17 and 19, and we had my daughter had a bad car wreck with put her not being able to live on her own, and so I've gone from couch to couch. Because you have to have certain amount of income for apartment to lease to you, or for you to rent a home, or for you to buy a home. And I don't have that resource as of yet to do that. Yes, we have a roof over our head when I'm in the car, but no, I have not gotten to a point where I can say I'm not homeless.
And I'm sorry to hear that, Kimberly. It breaks my heart to hear that, with you and your children being homeless. Even after your cancer journey, are you finding that your navigator is working with you to find adequate housing for your family?
No, she's not. She gave me the resource of of a shelter that women and children can go to. That was her solution.
That's interesting. Even though we don't work within your state, the type of person I am, I cannot let this happen to you. So Kimberly, please reach out to me after, and we'll see what resources that maybe we can connect you with within your state, please.
Yes, thank you.
Also,
Yes, I will.
Go ahead, Kim.
the strong Black, they know that sometimes we're not strong. They don't care. They don't care. I mean, they're banking on you not asking. They're thinking, oh, I hope she doesn't ask. So that's why I ask. I do it if for no other reason, to help them do their job better, because that's their job, is to help you.
This is
Just
true.
don't be afraid to speak up, thinking, oh, well, they think you're a strong Black woman. No, they don't. They're just looking at the value of your life. And you gotta, if you value your life, you gotta pull from within, just deep down within, to ask the questions, because they're hoping that you won't ask, because then they might have to actually do something. I came out asking questions just off top. Was I scared? Yes, but I think I was more afraid of dying, and I just had to speak up.
Oh, yes, Camille. I think you're 100% right. And I'm so glad that you had the opportunity, or you took the opportunity. You may not have had it, but you took the opportunity to ask questions, because you wanted to fare well throughout the health outcome. You wanted it to be good. And so it's very important. Ask those questions, even from the beginning. Talk to your providers and tell them, I don't think I'm going to be able to go through this cancer treatment financially, because there are things that your providers can do. In certain states, they can write off some of your finances. They also can set up payment plans as well. So this is why it's important to have, particularly if you have a financial navigator within the system that you're working in, there are professionals to be able to show you how to manage your finances and how to help you. Thank you so much, Camille. So let me ask this question here. I don't know if anybody will be able to answer this one, but how can faith and community leaders help to change the financial burden of cancer within the communities that they serve? Anyone?
I'll just say, I think if it's like faith-based, as far as just saying a actual, like church, members of the church or not members of the church, I feel like especially during October, just to have it as an initiative, knowing that there are, more Black women or more Black people in general who have disparities around finances. During the month of October, there's so many things that churches raise money for already. If they can have an initiative in October that raises money, that has a fund, and then is able to distribute those funds to people that are in their church or not in their church. But if they are out there to be able to raise awareness, raise funds like they do for so many other things, then I feel like definitely adding the breast cancer awareness and the financial burden to one of their initiatives definitely could help. It's a place where we go for so many other, financial for help. And so I feel like if they had something specifically for this cause, then I think it would definitely help the community.
And now I agree, Mauricia. And it's not only even just for the month of October, because you think about there are so many other cancers. People are diagnosed with cancer every day, so it's important that, our churches, maybe they raise funds, maybe not even just raising funds to help, but also educating their congregation about what resources are out there if you are diagnosed with cancer. So we have in our office what is called a community health ambassador training, and we train community leaders as well as faith-based leaders about the education behind 5 different cancers. We talk about the symptoms. We talk about financial barriers and how you overcome those. We also talk about diabetes and hypertension, which are other chronic diseases, but we educate individuals in these communities and churches to be able to share this information with others. And if our community health ambassadors within their church or community find that there are individuals that need to be referred to our office for the services that we provide to help them through a cancer journey, or connect them to primary care and ultimately to receive cancer screenings, then those community health ambassadors will provide us with a referral so that we can reach out to individuals to change the dynamics and to lessen the amount of health disparities that that person is going through.
That's a good point, Lasagna. Actually, recently I had a small community gathering where I gave some of the statistics from even Tiger Lily, just to let the community know that there's one in 4 of Black women who delay or refuse treatment due to cost. And so, like you said, with educating, if the community knows that that's an issue, then I'm hoping that they might even reach out to people who they know are going through a cancer diagnosis and say, can I help you with this? Because it is hard for us to ask, like that first question that you said. It's so hard to ask, but educating and knowing that it's such a financial disparity, then hopefully, there will be a different exchange of how can I help you, versus just letting someone continue to go through it without even reaching out.
Exactly. And so, a lot of people have a lot of pride, and it is pretty difficult for people to ask for help, but it's, hard enough to go to the cancer diagnosis alone. Please, for individuals that are going to come down this cancer journey pathway, please let them know that it's not, it doesn't take anything from them to be able to ask for help, because this is at a time when they definitely need someone to be there and to be able to show them what resources are available to handle their financial burden, along with other barriers of treatment.
I just wanted to throw this out there. I thought about this after you started talking. It didn't benefit me because I wasn't in Chicago at the time, but one of the resources my stepmom told me about, be a friend of hers who had breast cancer, who goes to church with her. Their church actually started I don't know the right term for it, but basically like a medical debt buyback program, where for members of the congregation, the church started a fund where they would buy your medical debt. They would call the collectors, and you might have, I'm just throwing a number out there. Let's say it was $20,000. They would offer to buy that debt off of the collector. They weren't going to pay the full $20,000, but most collection companies would rather take something than nothing. And they were invested in people who had, at this state, I think, well, her friend had breast cancer. So they were helping women in the city, in and around the city of Chicago, with paying back those debts. And I was like, oh, what an amazing idea. I think sometimes, again, to your point about just having these discussions with our churches, I think a lot more people are willing to give than we realize, but we don't necessarily raise the issue to them. The same thing goes with asking for help. It's hard to help a need that people aren't discussing or aren't aware of. And pride is a big part of it. I think it's always, for me, you asked about not wanting to get a social worker. For me, it's hard to say, I specifically need help. If it seems everybody else has figured this out, and in a society where a lot of times, I think when I hear social worker, I hear, neglect, I hear abuse, I hear unemployment, I hear all of these things that, okay, I'm surviving, I'm not quite there, I'm not quite at rock bottom, but I don't have enough to figure all of this out. But I don't want to take a social worker away from somebody else who might be in those phases of life. Nor do I want to have a full-on breakdown of all I'm going through to explain why, I don't look like I'm going through these things, but I am. The sheet that you showed to begin with the thermometer, I used to hate those sheets when I got to the doctor's office. I saw them and I thought, well, what are they going to do with this information? Because if I put on here that I'm at a 10, I'm about to lose my mind, I'm having anxiety, I can't get to work today, my car is out of commission. What does that mean? Are they going to put me in the mental ward and say, well, she's on the brink, so let me put a 6, but my blood pressure is high. So does that mean that I'm not going to get the resources and treatment I need? I hated the sheets because I didn't know who they were going to, who was looking at them. They slide it in with my paperwork, but is my doctor's not checking for it? So is the stranger, is this person who's not sitting here with me going to decide where my mental health is? Are they going to just look at the paper and try to make these decisions? And I said, no, I'd write just enough to make it seem like I cared, but not enough to trigger anybody to intervene. And that was the same approach with the social worker. In retrospect, I really wish I had, but I just kept thinking, no, if I tell them my life is falling apart after this diagnosis, it's going to spiral into something else that I can't venture into. I did not know then what role a social worker played. Everything I brought into it from the rest of the world. But to tie that back into your question regarding church, I think there needs to be more of a conversation and exposure of this need and the ideas that we have. Now that I'm on the other side of it, and God willing, I stay that way. I think that it is helpful for us to approach some of these, or everybody. When you go to church, you go to these other organizations, mention to them, like, hey, this is a way that I think that we can positively interact with our community. This issue exists, and there are resources that we can provide if we put our mind to it. And in a way, present it in a way to people so that they're informed. It's helpful when your friends can say, oh, my church does this. I find the lack of, what's the word I'm looking for? My social worker didn't come with my medical team. My nurse navigator came in, my surgeon came in, the assistant came in. The social worker was this person in a cloud someplace else. And to not have any personal interaction with this person, I don't know you, and I'm having a deeply personal experience in this room with these other people. So it's hard to say, hey, stranger, I see your name on this sheet of paper. Let me divulge to you the struggles of breast cancer from one, and all the things that you showed on that initial list. At that time, that's a deeply personal conversation about what's happening in my home, what's happening in my bank
Right.
accounts, what my fears are, not just pertaining to cancer, but my financial fears. I'm having a moment with my life about whether or not I can afford this MRI they just told me about. And I don't know your name at whatever institution.com, you know?
Yes.
And that is
Yeah.
hard. And that's the same thing about asking for help. It's hard enough for us to ask people that we know and care about for help. So it's even harder to try to convince. I was listening to Camille talk last week about having to apply for all of these resources, you know, the length of hurdles they ask you to go through. And I said, I couldn't imagine having to sit there and relive everything I'm going through and spend that amount of time putting my pain to paper to hope that you're going to give me assistance. Not guarantee that you're going to give me assistance, but hope that my scenario and story is just tragic enough that you're willing to help me. That is a pressure that I would definitely, I put it to the side and said, I don't even want to put myself out there and be vulnerable. Now I regret it because I'm struggling with financial payment plans and all of these things that I deferred during the time because I just said, I can't take it. I can't take it. Whatever it is, I'll deal with it later. But a large part of it for me, I rave about all the time how amazing my interactions were with my medical team, but it was brought to me. I didn't have to go seeking them. It's not true. That's not the same scenario when you're talking about the financial burdens of it. I was grateful. One doctor did say, you know, hey, you're diagnosed with cancer, so here are the things that we can go ahead and apply for you. And they did it. Jumped out there and that stuff got done. But the parts where I was put in the position to have to tell somebody else, hey, listen, I was diagnosed with this and this is what I'm going through and this is what's happening at home. And I deferred it. So church is a great place, or spiritual, you know, it doesn't have to be church. Spiritual centers, I think, are a great place to start with the information. I think about that a lot, about the fact that medicine and spirit should go hand in hand. Whatever you do or mental health, it doesn't even have to be a church. Wherever you go to connect with your mental health should also be connected to the physical health. And that goes in with the finances. A large burden of the cancer journey, mental health struggle is, if I survive, what does life look like if I can't afford to do anything? So I think that that's a beautiful connection to make. And to reach out. And like I said, one very practical, concrete form that I've seen it in is in debt buybacks from churches, of saying, hey, if you finish your treatment, we will assist with trying to buy that back and leaving you debt free.
You know, Jamila, I look at all of the subjects that you have just expressed. You know, one of the things that I want to talk about is the relationship that you have with a social worker or a navigator. Sure, it is very difficult to say to someone that you do not know that I need help with this, and this. So it's interesting because your viewpoint of that stress thermometer, I heard it so much. They're like, I'm so tired of seeing this, and what are you gonna do with it? I'm still at the same point, or at a worse point now that you're coming the second time asking me to put my stressors on paper. And I love it, that this phrase, pain to paper. That's awesome. You know, so it is all about the relationship that you have with your navigator. And if you're finding that that navigator is meeting your needs, not just hearing what you need, but there is a solution to your needs, then you gain trust. And so that's what you have to also have with your social workers. So within different systems, we know that there are so many patients that need help, but you are one individual and you should be paid close attention to for what your needs are. And before you take that stress thermometer, people should say to you, you know, you may not be going through these issues right now, but you may. And I'm here to help you. That's the reason why I'm asking you these questions. Not just putting down that you have stress with finances and checking off this. I'm having problems with childcare, but actually meeting those needs. And what I found is that when I started talking to my patients and we checked off those stress thermometers, I said, okay, so how can we help you within your life? How can we address that? And before I knew it, the third time I administered that stress thermometer, it was less and less checks on that sheet, right? And they began to trust me. And so they would come to me and they would share so many intimate things about themselves, because that you got to have that relationship. You really do. And so the debt buyback with the churches, I absolutely love that plan. Absolutely love it. But don't be afraid. If you're going through treatment, talk to your doctor and say, can you write this off? I cannot pay for this. Ask those questions. Ask them. And as far as copays, ask those questions. You know, I can't afford this copay. And normally the copays are really high when you go into a specialist. They can be $50 or above. And if you have to go several times a month, maybe you're not working. That is a financial stressor on you. So, you know, kudos to you, Jamila. I love your story. And even after this is over, I hope that I'm able to stay in touch with you guys, because this has been amazing. And I have enjoyed the opportunity to get to meet you and be a part of your lives today.
This is so awesome. Thank you. Thank you, Lasagna. Thank
You're
you so
welcome.
much. Um, Kimberly, Camille, Marika, Jamila, all those that have been writing in the chat. We have so many people who, it's such a safe space and a space to be able to have these conversations. Thank you for your transparency, because really, I think it helps so much to be able to figure out solutions. You know, there have been so many solutions that have been shared and talked about in this conversation, like even the idea of the just having a social worker come in. That's so true. I hadn't even thought about it, but it's true. That used to be like when you're a kid, it's like, I'm gonna call the social worker on you. Like, I'm gonna call somebody, like, you can go away. Okay. Like, don't talk too loud, because the child protective services are gonna come and like take you away. And you were so petrified of like your parents like trying to take you away. That was a real threat. And so it's so true. Like when you're in that vulnerable space, and like being able to be honest and share. And Lasagna, like just your warmth, like, and the way that you are approach it, you know, and talk to it's so, if everyone had that same kind of love and care, it would make such a difference, you know, and that feeling of being able to put that guard down. Like you said, yeah, you showed the thermometer but by explaining it and sharing it, you're like, you've seen that go down. And you know, that's something that even just thinking of, like, also a conversation of having more conversations with patient navigators and oncology social workers. And what I think someone had said about like the heart part, that's something, and bringing that together, bridging that gap between that, because patients are people and they're human, and they're people just like you, they're the family. Every one of us at some point has or will be a patient. And
Yes.
you know, being able to understand that, that these different roles that we each have to play, and having empathy, really, you know, I know for our San Antonio breast cancer symposium in December that we're having, Tiger Lily, our session is on integrating the soul into science. That's the topic, exactly, just what you were talking about, because that's so important, you know, having that kind of conversation. And like, you know, and I know we're talking about faith and our faith-based communities and our church families. And I love the idea, Jamila, that you were saying about the buyback programs. And I know, Marika, you mentioned in the chat about trying to have that conversation about life insurance and getting pushback from your communities as well. That's something that's real, because, you know, we talk about it, but it's also, you know, it's like a double-edged, like we also get pushback from the same people that we're reaching out to get help. And so hopefully this is a space, you know, we've created some solutions, and even for those who are part of these financial resource organizations, to have empathy and to think, you know, or maybe even to try to figure out a different way to have a conversation. How can we help to provide resources without having someone relive the trauma that they're experiencing over and over and over again? Is there another way that we can do it? Could it be through a conversation, you know? that we can have that to be able to get that information. Could it be through a phone conversation, something? But I just throw that out to some of our advocate organizations that have chimed, that are here, to be able to brainstorm and try to think of different ways that we can get this, and to be able to get the resources to those who need it the most. Are there any other, comments, or just, this is a safe space, so please feel free to continue the conversation. We have another 15 minutes on, so if there's anything you want to dive in a little deeper or share, please feel free to do so.
About grants, you don't have to necessarily rehash everything. As a matter of fact, one woman I spoke with yesterday was like, we don't even want to know. We don't care what stage you have cancer. That is all we need to know. So sometimes they don't need a lot of in-depth detail necessarily. And most grants tell you the criteria up front anyway, so you kind of know whether or not to apply. Like it'll tell you like, this is like, there'll be specifics if you read like in the fine print. So I don't even apply for a grant unless I think there kind of is a good idea that I'm going to get it. So I'm not wasting my time. But I think the key thing for a lot of it is the time frame. Like, because in my mind, I was like, once I get past the cancer, that's when I'm going to start applying. Like if I can beat this thing, and once I have my surgery, and once I'm done with my chemo, and once I'm done with my, then I'll backtrack. That's not how any of this works. You have to be in active treatment. That is such a key word, because afterwards they're like, well, you don't really need the help. I'm like, of course I do. But unfortunately, a lot of the grants and scholarships, they want what is considered active treatment, which is kind of hard to be doing that while you're in active treatment. And that's what I know now. And so now I tell others that are in active treatment, don't wait until your treatment's over, because you're probably not going to get the help. You're going to have to do it now. I can help you, but do it now in that time frame of what's considered active treatment.
And Camille, that is so true. I look at women such as Kimberly that have suffered through, and towards the end, there is not a lot of resources that you can find to help you, unfortunately. So, within your healthcare system, hopefully you're able to reach out to a social worker or a navigator that's able to help you through that process, and each situation is different. If I can be transparent right now and share with everybody that's on the call, I've been a navigator for over 16 years, right? And in 2013, I was faced with a cancer diagnosis without insurance. I worked for Duke, right? That should never happen. I wasn't working for Duke then, but I didn't have insurance. But because I knew what to do, I called the social worker into my room and I said, here's all my paperwork. And she's looking at me like, what you mean? I said, I'm eligible for Medicaid within our state. She's like, how do you know that? It's because I had been helping patients for years. And so within 2 weeks, I was able to have Medicaid to pay for all of my treatments and all my surgeries and everything, but I think I am blessed, because I think about women, men that do not know how the system works, or they do not have access to the resources, and they struggle throughout the cancer journey. It's hard enough. And I remember the day when I was told that I had cancer. It's hard enough to be told that, because you don't hear anything else but I have cancer. And all these other barriers rush in. And I have had patients that will not open their medical bills when they come. They just put them in a stack. So when they have gotten to me as a navigator, it's like, okay, here's a stack of bills, right? They was like, nobody was there to help me. Nobody even reached out to me, So we have to peel back all those layers. And we have to say, hey, look, let me help you. Let me take a look at this for you. Some people don't have the strength to do that when they're going through treatment. It is too overwhelming for them. So I love, love, love the conversation that is going on right now. I really am hoping that this helps others that will be diagnosed with cancer, that they're able to handle their financial burdens, or any other barriers through the conversations that we're having today. Thank you so much, ladies.
Real quick, I don't know if anybody mentioned this, but you triggered something for me. One of the most stressful parts of some of my appointments was that when doctors were mentioning, we're going to recommend that you take these 3 drugs, or your chemo is going to consume this. Oftentimes there was we have to wait for approval from your insurance. In that gap time of wondering, well, if my insurance says no, what does that mean? Now you've already put in my head that my life, my existence on this earth is dependent on these medications, but there's a chance that somebody is going to say, no, I can't afford it. I wish that there was some way in between, or to fill in that gap of space between when a doctor says, hey, this is what's needed, and they call you in. If there was some way for that information to already be in process. Because to your point about the mail, I remember the first time a doctor said it, and I kind of heard it, and I said, well, it doesn't make sense. How would an insurance company deny something that my life depends on? But then I get the letter in the mail that says, oh, listen, you've been approved or whatever, or not approved for this. And that is, I absolutely am the person that put the mail in the corner. I still got them now. My purse probably drop out 10 different envelopes from different medical treatment places right now that I have not opened in the last 6 months because I don't want to see it. Same thing with post-treatment. I have to take pills for the next 10 years. And it seems like every few months I get a letter in the mail that says, oh, you were approved. And in my head, I'm like, so there was an option? At some point, one of these letters might come to me and say that my medication is no longer approved. And that is there, at least on mine, if I could recommend something or suggest something that we change in the way it's handled. Before someone tells you that your life depends on this bottle of pills or this syringe of medication, we might want to already check and see whether or not the patient can afford to do that, and whether or not the doctor needs to be able to prepare to say, well, here's an alternative, or navigator or social worker needs to say, hey, there are grants available or something available. Because the stress of someone saying you're going to live or die if you don't take this medication, but hey, you may not be able to afford it, is terrifying. It's absolutely terrifying.
It is, Jamila. That is a great point. A navigator that is experienced, they're going to let you go through your insurance company to find out if you are approved, but they're also going to have a backup plan. They're going straight to that pharmaceutical company and say, what are the qualifications for individuals that need this medication? A lot of the pharmaceutical companies, you can have insurance because they know that the insurance companies will not pay for the medication, right? And so it's important that a navigator is working on your behalf in both ways with your insurance company. Because number one, if the insurance company says they're not going to pay for it, your provider can write a letter stating the necessity for having that, and that can overturn a decision for an insurance company. And number two, going straight to the pharmaceutical company, you may already meet the requirements. That application can be in. So if your insurance company turns you down, here's an alternative. That's what navigation is about. And a navigator must foresee some of the barriers that are going to come about. And that's what I enjoyed about it, because I could have a conversation with my patient. I'd be speaking to you and I say, hey, well, we're going to see what your insurance company says, but we're also going to be working on this end. So that's about experience, nothing more, nothing less. So, hopefully you have experienced oncology navigators, social workers around you. It's important. That's very important.
The one thing I wanted to say to echo your points, Lasanya, and thank you for sharing this enlightening and empowering information. At that same time, we also, as navigators and in that space, need to equip our patients, their caregivers in the community, with the skill set to advocate for themselves. Because you are going to be your best fighter. You are going to be your best attorney. You know what I'm saying? And when it comes time to these appeals, knowing where to go, how do I get this information? You are your best advocate And you have to, when I see those shirts that say, you fight like a girl, and they're talking about lung cancer, I'm like, you're right, pull your hair back. You know what I'm saying? It's time to get going.
That's
You know what I'm
right.
saying? It's a rumble in the jungle, right? And I wish you would. That's what you got to say. When you get that diagnosis, you go, I wish you would. You know what I mean?
That's
But
right. That's
what?
right.
What we got to do? You know what I mean? As I say, it's time to, not to say man up, but you know what I mean? It's time to
That's
get
right.
your crew and come. And you need to have a strong network. That is the truth. I love that. Not if you buck. So cancer needs to recognize it's about to be on and popping. You know what I'm saying? It need to recognize.
Right.
Not
Thank
if
you,
you buck.
Kirsten. Only you. Nothing your book. Okay.
I can't say that. It was in the chat and I just agree with it. That is the truth. That needs to be the next shirt. Knock if you buck. Cancer diagnosis,
I
knock
love
if
it.
you buck.
I
You know,
love it.
and just gear up your support system. I can't say that enough. And someone had also shared, once the diagnosis is over, you know, then where do you go? And also looking at that in regards to the family, the caregivers, and the extended family as well, and navigating that piece. And so thank you all for having this space to have these crucial conversations.
Kirsten, thank you for that. Now, you're within our office. We can go ahead and create that T-shirt so we can wear that. Okay. I'm
I know that
challenging
might
you
be
to
a
do
little
I
that.
need one. I'm just saying, I think we all need one of those Nug If You Buck t-shirts.
We do it. So it starts with Kirsten because she created the idea. So, you know, once you get that created, just let us know when we can order one, okay?
I'm telling you,
Yes.
I'm all about supporting the messaging. It's all
I love it.
Yes,
love
I think Kimberly, you had your hand raised. Oh no, you just wanted to raise your hand that you wanted a t-shirt too. Got you. Yes, definitely. Um, well, we just, just thank you all again so much for participating in the conversation. I'm going to share my screen because I really want to at least give everyone opportunity who is on to be able to at least take a screenshot of this really quickly. Oh, sorry, not with the music, but to be able to take a screenshot of all of our participants so that we can at least be able to keep in contact with them. And so please just, take a minute to take a screenshot of their information and to be able to contact them. All right. And I'm going to stop sharing my screen. I just wanted to give us an opportunity to do that. Again, thank you all. Thank you, everyone, our panelists, for such a great, impactful conversation, such truth and honesty and just realness. I think a lot of, really needed to hear that. And so, just honoring you all. Thank you, Lasanya, for the depth of information that you were able to bring to this conversation, the heart that you brought to this conversation. And like you said, when we had our prep call ahead of time, how God used you in this, we don't know sometimes why God is doing certain things, but for you to have a cancer diagnosis, to be on the other side of that, to be able to understand what that experience looks like has been such a blessing. And we're blessed because of that, because of what you've been able to share with us and that heart that you continue to bring into the work that you do. So thank you so much. And to each one to Kimberly, to Camille, to Jamila, to Marika, thank you all for being Tiger Lily angel advocates, for being advocates within your community, for sharing your stories, for being able to be honest with that. My prayer, like for us, is to continue to be able to provide financial solutions. Kimberly, we are on it to change that situation that you are in right now. You are covered. We are surrounding you and going to figure out what to do for you because of what you're experiencing. And thank you for being open enough to share that, because we don't share it. Like Jamila was saying, we, especially in our communities, we don't share that. There's a pride that comes in that we don't talk about it, but it's so important for us to be able to help and surround you. Like Marika said, we got you and we're holding you. So you are not alone right now. We have got you. We're going to do everything that we can to change that situation and to continue to support other women just like you that are going through this. You have 2 sons, and you're going through this treatment, you're going through this trying to get with your work and everything. So we're here to support you during this time. We're just holding you and lifting you up as well. So that conversation continues offline. We are a family. Our Pull Up a Seat group, everyone who participates in this, welcome to those. This is your first time. You're now part of our Pull Up a Seat family. We're going to continue to keep this going because this doesn't stop just because of this conversation ends in 2 minutes. This is life. This is real life that we're living, that each person on this call is living. And we have to keep helping each person. We're all part of a global community, all part of the human family, and we need to help our brothers and sisters in that family. So we are, and for those, if you don't hear from Kimberly, please reach out to her too, because to be able to reach out to her as well. I'll definitely put again her information in the chat as well, so that we can be able to surround her and circle her as well. And for those who I know, we have our advocates, our angel advocate, well, sorry, not angel advocates, but our financial resource advocacy organizations that are on. Thank you for being here and for the work that you guys continue to do towards helping patients. We really do appreciate it. And hopefully this information will help you to be able to do your work and help to support others better as well. So thank you guys, everyone, for joining. Have a blessed.